recording. Yeah. Hello, everyone. Thank you for joining the Climate Smart Healthcare webinar today. Today's topic is the Healthcare Climate Challenge, a call for health sector climate action. So first, I'll give an introduction on our organizations and the work that we do. Healthcare Without Harm is an international NGO that transforms healthcare worldwide to reduce its environmental footprint, become a community anchor in sustainability, and a leader in environmental health and justice. Healthcare Without Harm has regional offices in Asia, Europe, and the United States, a team in Latin America, strategic partners in all these countries, including India, as well as international partnerships. One of the strategic partners in India is the Center for Chronic Disease Control. We are a New Delhi-based not-for-profit organization, and we've been in partnership with Healthcare Without Harm since 2016. And we work in India to implement projects in the space of green and climate-resilient healthcare. One of our initiatives in collaboration with Healthcare Without Harm is the Health and Environment Leadership Platform. This is a membership and networking platform that's made up of over 75 members, and which constitutes more than 7,700 healthcare institutions and over 100,000 physicians in the country. And HELP offers strong policy advocacy presence. We train our members, we do education and training of our member institutions, and also communication to public on environmental issues. And we also support our members in reducing their environmental footprint. And one of our initiatives under the education and training is the Climate Smart Healthcare webinar series. And now I'll hand over to my team lead, Dr. Purnima Prabhakaran. She'll give an introduction to the Climate Smart Healthcare webinar.
Thank you, Indu. Good afternoon, everyone. On behalf of my team at the Center for Chronic Disease Control, it's my pleasure again to extend a very warm welcome to everyone who has joined us here at this webinar today. As my colleague Indu just outlined for you, we are working in this space of climate smart healthcare in the Indian health system for the last almost 18 months now. And as we all know, I think it's a well-known fact now that the climate crisis is a health crisis. India is among the most vulnerable of countries to the impacts of climate change. Those impacts are often outlined as both direct as well as indirect. Direct mostly on health as well as the health systems, and indirect in terms of impacts on other sectors, for example, nutrition, affecting crop production and affecting food and nutrition security, and affecting very many other domains in our country. As people working with the health sector, we are very much aligned to advancing the needle on the climate and health agenda. For example, we are working very closely with the Government of India's Ministry of Health and Family Welfare in the National Program for Climate Change and Human Health, helping to develop a health and national adaptation plan for climate smart healthcare. In that direction, we've been working to increase awareness on the concept of climate smart healthcare for about 2-3 years now. And so this webinar series is one step in that direction, given the fact that climate change issues, other environmental issues like air pollution are really not a part of curriculum within mainstream medical education or nursing education or any of the allied healthcare professionals. So building capacity of healthcare professionals itself is an important initiative that we have taken up. And the Climate Smart Healthcare webinar series is one of those important initiatives. So just to get everybody on the same page, I know there are a number of people who join these webinars regularly, but for the interest of those people who haven't joined one before, I just wanted to define for us over here what is the concept of climate smart healthcare. We've heard of concepts like climate smart agriculture, climate smart transport. So climate smart healthcare is about working with health professionals and health systems in India, both in the private as well as in the public health system, about 2 pillars of action which constitute climate smart healthcare. One of them pertains to preparing the health sector professionals, enhancing their awareness about the health impacts of climate change, of acute climate events like floods, droughts, heat waves. And the need to do this is become all the more critical because of the increasing frequency of such acute climatic events. And preparedness and adaptation and resilience of health sector to acute climate events, being structurally and functionally resilient even in the event of heat waves or floods, for example. All of that constitutes one pillar of adaptation or resilience. The other pillar of climate smart healthcare is about health systems becoming climate friendly as well, in the sense environmental friendly initiatives even during healthcare delivery in the time of crisis. So becoming environmental friendly itself entails action in a number of different domains, which includes where we site our healthcare facilities, what kind of buildings we have for our hospitals, what are our energy consumption patterns, how are we dealing with other resources like water, the waste that is generated in healthcare facilities, using transport in optimal manners, sustainable forms of transport, sustainable procurement of all the equipment and pharmaceuticals that we require to use in healthcare. And at the core of everything, climate leadership and generating funds to deliver all of these initiatives. So the whole concept of climate mitigation constitutes the other pillar of climate smart healthcare, where we are working to reducing our own environmental footprint. So these two concepts of climate adaptation and resilience, and climate mitigation, or reducing our environmental footprint of the health sector, constitute climate smart healthcare. And through this webinar series, the Climate Smart Healthcare webinar series that we have been hosting for the last few months, we have tried to bring in different domain experts to talk about each of these different aspects of climate smart healthcare. Now, the webinar today is focusing on a global initiative called the Healthcare Climate Challenge. And I'll hand over to my colleague Indu to tell you more about this Healthcare Climate Challenge and how healthcare actors around the world have been doing their bit to address the climate challenge, and how we in India want to handle our healthcare actors also to do the same. So with that, I'll hand over back to Indu to walk us through this Healthcare Climate Challenge initiative. Indu, over to you.
Thank you, Dr. Purnima, for the introduction to Climate Smart Healthcare and also for the webinar today. So this is going to be the outline for the webinar today. First, I'll set a short context for climate change and also the impacts of climate change on human health specifically. And then I'll move on to the need for health sector climate action, and then to the main part of today's webinar, which is the Healthcare Climate Challenge. So this is a context setting for global warming. As many of you know, there is a natural greenhouse effect that happens on the planet, which maintains the temperatures and conditions that are favorable for life to happen on Earth as it is currently. Under this natural greenhouse effect, the solar radiation from the sun enters the atmosphere, and some of it is it's absorbed by the Earth, and some of it is radiated back into the atmosphere. Some of it escapes into space, but some of the radiated heat is trapped by the greenhouse gases that are present in the atmosphere. So currently what is happening is the human enhanced greenhouse effect, where there is a lot more greenhouse gases present in the atmosphere. So if you look at this table here, there's a list of greenhouse gases and also the sources for the greenhouse gases that are emitted from human activities. So these include fossil fuel combustion, deforestation, agriculture, fertilizer use, and also industrial processes. Because of all of these human activities, there's a lot more greenhouse gases present in the atmosphere. And due to this, a lot more heat is trapped in the atmosphere than escaping into space. And because of this, global average surface temperatures have been continually increasing over the last century. And currently it is almost 1 degree over the pre-industrial levels. And what this means for the climatic conditions in the Earth is that due to the increase in global temperatures, there is a change in climate that is happening around the Earth. And this is broadly termed as climate change. And these are the main aspects of climate change that are happening currently. And some of it is rise in sea level. So because of the increase in global temperatures, there is a melting of glaciers and polar ice caps, which is increasing the sea levels. There is also a rise in oceanic temperatures. So a lot of the heat that is, a lot of the increase in global temperatures is absorbed by the ocean, which is also altering the processes that are happening inside the ocean. There is also a change in the precipitation around the earth. So in some areas of the earth, we will have more droughts, and in others, more floods and more extreme weather events such as storms. There's also going to be a lot more wildfires due to increased temperatures and also a lot more heat waves. And what do all these climatic changes mean for human health? That you can see in this very succinct diagram that shows that due to all of these changes in the climate that have been mentioned in the previous slide, there are going to be all of these health impacts on humans. So, for example, due to more wildfires, there's going to be more respiratory conditions and more injuries and disability. Due to increased rainfall and storms, there's going to be more waterborne diseases and vector-borne diseases. Drought is going to contribute to crop failure and food insecurity, as Dr. Purnima mentioned, and this will also lead to all the effects such as undernutrition and malnourishment. Sea level rise will also contribute to crop failure. Heat waves will lead to more cardiovascular diseases. And all of these extreme events in general will also contribute to social impacts such as forced migration, also impacts on mental health, as well as disruption of medicine supply. So these are all the impacts of climate change on human health. And this is why the health sector has a responsibility to take climate action. Firstly, also because the health sector contributes to the problem itself. 4.4% of net global emissions on the planet is from the health sector. And this is not an insignificant number. If the health sector were a country, it would be the 5th largest country in terms of greenhouse gas emissions. And as seen in the previous slide, the climate crisis is a health crisis, and it is also the biggest health threat in this century. This is why it is very important that the health sector build its resiliency and adapt to the impacts of climate change. There's going to be a lot of more increased burden on human health as well as the health sector. And the health sector is in an important place to take action because nurses and doctors are amongst the most trusted voices among professionals. A lot of times the public is hesitant to listen to other professionals such as scientists, but are very receptive to messages from the health sector. So this is why it's important that the health sector take climate action. So now we can move on to how the health sector is taking climate action around the world. And one of the ways in which globally the health sector is doing it is through the Healthcare Climate Challenge. This is an initiative of Healthcare Without Harm, and it was launched at the 2015 Paris Climate Conference. This climate challenge basically mobilizes the healthcare institutions around the world to play a leadership role in climate action. And currently we have over 26,000 hospitals in 43 countries who are participating in the Healthcare Climate Challenge. And in India, we have 7 healthcare institutions that are leading the way in health sector climate action. So now I'll move on to what are the different parts of the Healthcare Climate Challenge. All health institutions that join the challenge basically pledge to take climate action through 3 following pillars. The first one is mitigation. Mitigation is reducing the carbon footprint from a facility, which is reducing the greenhouse gases that a facility emits. The second pillar is resilience. Resilience is basically anticipating, adapting, and recovering from the impacts of climate change, both on the facility and as well as the community. The third pillar of the climate challenge is leadership. Leadership asks the institutions that join the challenge to leverage their respected position and to raise awareness and influence policy for climate action. So moving on to the first pillar in the challenge, this is mitigation. So healthcare institutions that join the Healthcare Climate Challenge will have to do the following things to mitigate their greenhouse gas emissions. The first step is to measure the baseline emissions that a facility is emitting. So this is about measuring the current levels of emissions from the healthcare institution. And this can be done using the Climate Impact Checkup tool. This is a tool that's been developed by the Healthcare Without Harm organization, and it's specifically developed for the health sector to measure the emissions from hospitals. After measuring the baseline emissions, the second step in mitigation is to have a mitigation plan. This would look like setting an emissions reduction target, for example, 30% emissions reduction by 2030, or whatever other target the hospital wants to set. And after that, the next step is to create a plan of action to reduce the emissions. So after seeing what the baseline emissions from a facility is and where all the major emissions are coming from, the hospital can decide what are the different actions, sustainability initiatives that it's going to take to reduce its greenhouse gas emissions. And the third step is, after making the plan, to take immediate actions based on the plans. The second pillar of the healthcare climate challenge is resilience. And there are two aspects of resilience that hospitals have to work on. First is the health sector facility resilience, and second is community resilience. So under healthcare facility resilience, there are different steps that hospitals can take to prepare themselves and also adapt to the impacts of climate change. So one would be conducting a vulnerability assessment for future climate disasters. So this would look like assessing what is the current climatic conditions that the facility is existing in, what are the future changes that are going to happen in this climatic region, and how is that going to affect both the healthcare facility as well as the community in terms of the diseases that it might have. Another thing to do is have a disaster management plan. So after identifying the different ways a hospital is vulnerable to climate disasters, disaster management plans can be made by hospitals to outline the ways that hospitals are going to adapt and recover from disasters. And a third step in facility resilience is also to create a pandemic response plan. So it's also been shown that due to climate change, a lot more new pandemics are going to come, just like the COVID pandemic. So it's important that hospitals also create a pandemic response plan, and it can be done with examples of how hospitals responded to the COVID pandemic. The second aspect of resilience is community resilience. And this involves two aspects that the hospital can take action in. One is community resilience building, and this would look like ensuring that the community is aware of climate change and knows how to take care of itself, for example, in cases of heat waves or other disasters. The second aspect is ecological restoration and resilience. This includes, for example, ensuring that the ecosystem around the facility and also in the broader area is restored. For example, one of the healthcare climate challenge participants in India is, they do a lot of afforestation drives. So they plant a lot of trees both within their hospital premises, but also around. And this is one way to increase ecological resilience and restoration. For example, this will contribute to reducing the impacts of heat waves. Having a lot of trees around would reduce the impacts of heat waves and also reduce the impacts of flood. So this is one example of how ecological restoration and resilience is also done for increasing community resilience. The third pillar for the healthcare climate challenge is leadership. Under this, hospitals can take initiatives under the four different types of leadership. First one is communications leadership. So hospitals should educate and raise awareness in their both for their staff, for their patients, and also for the community around them on climate change and its impacts on human health. Second is policy leadership. Policy leadership is about promoting policies and legislation that protects public health from climate change impacts. So if the hospital is in a position and it has power to influence government policies, then it should take action to promote policies that protect public health from climate change. The third is governance in practice. This is more about how the facility runs and the choices that hospitals make for running that facility. And steps that hospitals can take in this include creating an organization team dedicated to climate change work. So a lot of hospitals in India currently don't have a specific separate team that work on environmental sustainability. And creating such a team would help hospitals have a dedicated team and personnel who can work on sustainability initiatives. Other governance and practice initiatives look like having a green building policy and ensuring they're complying to green building policies, and also having a climate change policy itself for the entire hospital. The final aspect of leadership is economic leadership. This looks like investing in clean energy instead of coal-fired power. And second is to have sustainable procurement in the hospital, ensuring that all the supply chain from which the hospital is buying from is working towards sustainability. And the third one is financial impact assessment. This is doing an assessment to see how implementing sustainability initiatives at the hospital can be financially beneficial for the hospital. So these are the three different pillars: mitigation, resilience, and leadership, that come under the healthcare climate challenge. So what are the support, the tools and resources available to hospitals that join the healthcare climate challenge? So one, as I mentioned before, is the climate impact checkup tool. This is a tool that can be used to measure the baseline emissions of a healthcare facility. It can also be used to identify carbon hotspots. These are areas in which the hospital is emitting more emissions. For example, if a hospital is emitting a large amount of emissions from its energy use or from its supply chain, you can identify this using the climate impact checkup tool. And then you can also compare emissions with hospitals around the world who are doing the challenge. You can have access to all of that data. There's also going to be a training session for the climate impact checkup tool in the next week. So those who are interested in learning how to use the tool can join that webinar as well. There's also access to guidance documents that all the participants will have. So there are various guidance documents that will tell hospitals how they can implement sustainability initiatives in different aspects. So for example, we have guidance documents on building, water, waste, energy, also sustainable procurement and chemicals as well. So all of these guidance documents will provide information on what are the concrete steps that hospitals can take to make their facilities and operations more sustainable and reduce their carbon footprint. There's also training and support available for all the hospitals who join the Healthcare Climate Challenge. So any hospital that joins will get training on how to use the climate impact checkup tool and how to track the emissions and how to reduce it, and also support on creating an action plan to reduce their emissions. There is also an awards program for all the hospitals who join the Healthcare Climate Challenge, and this can provide the hospital global recognition for the sustainability initiatives that they are taking. So there are different awards that are available for the participants of the Healthcare Climate Challenge. So under mitigation, there is Greenhouse Gas Reduction Award, Energy Efficiency Award, Renewable Energy Award, and Non-Energy Greenhouse Gas Reduction Award. And then there's also a Climate Resiliency Award and a Climate Leadership Award. So to be eligible for getting these awards, a hospital has to be an official participant of Healthcare Climate Challenge. They should set and track their progress on each of the climate action pillars, and they have to submit their data annually on their progress. So this is an overview of the Healthcare Climate Challenge and what it involves. Finally, I just want to say that the Healthcare Climate Challenge and climate action is an opportunity for the health sector to reduce its carbon footprint and to improve patient and community health, and also an opportunity for hospitals to anchor institutions for their communities and to be a leading advocate for healthy people on a healthy planet. So I'd invite hospitals and healthcare institutions to join over 26,000 hospitals globally in the Healthcare Climate Challenge. And those interested to join the Healthcare Climate Challenge are open to do so by emailing us at help.ceh@bhfi.org. So that is the end of the webinar session today on Healthcare Climate Challenge. If anyone has any questions on how to join the challenge or anything else, you're welcome to ask questions now.
Thank you, Indu, for that very lucid overview and I think refresher for us on the Healthcare Climate Challenge. So if anybody has any questions on adopting this initiative in their facility, you could either unmute and ask your question now, or you could post a question on the chat as well, on the Q&A. You could also email us later at this email, so we can take it from there as well. So Indu, while we wait for that, can you tell us a little bit more about the reporting for this healthcare climate challenge? How is that done globally, and how can we help people in India who join the healthcare climate challenge?
Yeah. So this goes into more detail on the technicalities of the challenge. So all the hospitals who join the challenge will have an account created on an online portal called GGHH Connect. So on this portal, you have all of the tools and support that I mentioned in the previous slide. So all of this is available on GGHH Connect. So all of this will be available there. For example, the climate impact checkup tool and all the guidance documents are available on GGHH Connect. And also there are different forms, online forms where you have to submit your data. So there's a form each for mitigation, resilience, and leadership, under which there's a lot of questions that they ask, and you have to fill in all of the work that you're doing under mitigation, resilience, and leadership. And this has to be filled in once annually, and around September is when they ask for that for all the data annually, and after that you will be eligible to get the awards for each year. And all of this is completely free as well. Joining the Healthcare Climate Challenge and getting all of these tools and the training sessions, all of that is completely free for hospitals who are interested.
I guess pertinent to mention here is also, like I mentioned at the beginning, the concept of climate smart healthcare has, according to what we are developing as a framework for India, at least 10 components, 10 domains, which speaks to starting with the site of the hospital or the healthcare facility, to the buildings, to water, energy, waste, transport, procurement, what's the one I'm missing? So climate, the leadership, and financing. Yeah, climate information services. So there are guidance documents, as you see over here, on building, water, waste, energy, and then there are guidance documents to help people do their climate impact footprinting kind of exercise. But additionally, also in the realm of procurement, there are a good number of documents that will help hospitals and healthcare facilities also map their procurement mechanisms to transition to more sustainable forms of procurement practices. So I guess we need to add those resources as well.
Yeah.
So anybody online wants to add or ask any questions, or anybody on our team as well have anything to add here, please feel free to do so. Just to add that the awards also means global recognition. So any hospital or healthcare facility that joins this healthcare climate challenge while competing here at regional level and winning awards at the country level, you actually will have a global recognition, as in be listed amongst the hospitals around the world who have won these awards before. Anything else on that, Indu, on awards and different levels of awards, or anything that you can add?
So the awards ceremony happens every year, and all the eligible participants are also, you can go to the place where the award ceremony happens. It's often not in India and places abroad. So all the hospitals who are eligible and who win the awards get global recognition, and also have the opportunity to go abroad and meet other hospitals who are doing all of these initiatives and who have won the other awards.
Yes, so documenting your own best practices in the form of this healthcare climate challenge initiative is one thing, but also our team has been regularly documenting good practices in healthcare facilities across India in the form of case studies, which again receive global recognition. So this is really a call to all participants to please consider joining this healthcare climate challenge.
Just once again, anybody who's interested can email us at help.ch@phfi.org, and it's completely free to join, and we can help you with all of the what's needed to work on the healthcare climate challenge.
Okay, somebody's raised the hand, I think. Abhijit. Yeah, Abhijit, I think you can unmute and speak.
Abhijit, I think you can ask a question now.
You've got to unmute yourself. Can he unmute himself, Indu, or does the host have to do it?
He can do it himself now.
Yeah, thank you for the nice presentation, Indu. So I just wanted to highlight, actually, if you could tell a bit about the guidance documents, actually, to what extent is it subjective to different kind of hospitals and hospital infrastructure, actually. So, for example, where the hospital is situated, what are the facilities available currently, and how could they improve upon? So can you just slightly elaborate on the documents? Are they a common document for each of the sectors, or for each of the sectors they have some different kind of objective mentioned in those documents, actually? Thank you.
Yeah, so all of these documents have been created from the leading experts in the space of all of these different aspects. So one we have for healthcare, building sustainability, water management, waste management, and energy. And one thing to note is that these are generalized documents for all hospitals that they can take. So it's like a document that's for global audiences. All healthcare climate challenge participants from around the world refer to this. So in that way, it can't be very specific to each geographic region. There are a lot of steps that hospitals can take no matter where they are in which part of the world, but it won't be very specific to each geographic region. But it is very specific in terms of what they're talking about. So they have a chemicals guidance document and a procurements guidance document. All of these are go into very specifically all the different chemicals that hospitals currently use in different parts of the world, and how you can change and to which chemicals you can change instead. So these documents go into much detail, but it's in a general global level and not very specific to, for example, Indian context.
Thank you. So it should give the idea that how one should proceed with the available information and kind of lead through the path, actually. And perhaps apart from the documents, actually, the guidelines, actually, one has to kind of develop or sort of create their own plan to reduce the mitigation. Yeah. To enhance the mitigation and reduce the carbon footprint. Yeah.
Yeah. So because it is very context specific, they have a guidance document on how to create an action plan, and this gives guidance to hospitals on how to have your own specific guidance plan for your hospital. So how to analyze your emissions, and from that how to create an action plan that is specific for your hospital. So while these are general guidance documents, they also have a document on how to create a specific action plan specific to your own hospital.
Great. Thanks, Indu.
Yeah.
So I don't see any questions in the Q&A, Indu, in the chat.
Nothing at the moment. Yeah.
Yeah. Okay. So I think we can wrap up then, and can you just put up the email ID again so that anybody wanting to reach out individually can do so. So this is the contact email ID for our team who will help you with this. If you want to join the Healthcare Climate Challenge or get any further details on this initiative, please do write to us at this email ID. Thank you for joining us all today, and thank you, Indu, for handling the presentation and providing insights to the participants about this whole healthcare climate challenge. Thank you all on behalf of the team at CCDC. I'd like to thank you for joining us here today and look forward to hearing from some of you on your interest in joining this challenge.
Thank you. Have a good evening, everyone.
Thank you.
Thank you. Bye-bye.